Hey, Dr. Brad Murray. Today I want to go over the most common cause of shoulder pain. Shoulder pain is usually a rotator cuff issue. That doesn't mean that the rotator cuff is the thing that you need to treat to make it go away. The rotator cuff is just a series of 4 small muscles that kind of act like ligaments that move, and they tend to be the ones that will eventually shut down and cause so much pain that you start to have trouble moving the arm in either rotation, lifting it, getting your arm overhead. So the shoulder is made up of 3 main areas that you have to take a look at to understand which one of these areas is causing the biggest problem. Shoulder, your true ball and socket joint, that's where the rotator cuff holds the head of the humerus into your scapula, your shoulder blade bone. Now, the only attachment from that is to your whole thorax. The rest of your body is through your clavicle here. So we have to know first, how does that shoulder move? And then we have to know, how does your scapula move? That's the base of support that the ball and socket joint of your shoulder sits on. So we need to know how both of those things are moving. And then coming back even further, we need to know how your upper back or mid back rotates. That's where a lot of your flexion extension comes from through your body to put your shoulder in the right position where it needs to be. A lot of your power comes from there. That's why a jab isn't that big of a punch, or that strong of a punch, that forceful. When we want to do something, we rotate through our T-spine to bring a big hook. Power generating areas through here. So here's how we separate the 3 of them out to see which one might be the biggest issue. The biggest issue usually with a rotator cuff is either being able to lift your arm above your head. If that's a problem, probably something to do with rotator cuff. You can't hold your arms even at 90 degrees, probably something to do with your rotator cuff. Once again, doesn't mean the rotator cuff's what needs to be treated to fix the issue, just means that's definitely something that's aggravated or impinged, pulled, torn, fully torn, partially torn. It all depends. It kind of lies on a spectrum. So first you want to see, are you able to stand tall, externally rotate your shoulder past 90 degrees? This is 90 degrees. You should be able to get past there without too much arching of the back, low back, upper back. Straight on, see if you're able to get past 90. And then most of the things we do is in a slightly flexed position. So you want to see in this slightly flexed position now where we're taking your whole shoulder blade, your whole thoracic spine out of it. You want to see if you're still able to go to 90 degrees there. That gives us an idea if we have external rotation. External rotation and that ability to get your arm up like this are the 2 things that go off usually first. Last one is you just want to make sure you can lift your arm off your low back like this without too much forward movement of your back and shoulder. Take a look at those 2. If this hurts or if this hurts, you're definitely doing something to aggravate that glenohumeral joint or your rotator cuff area. Next thing is your scapula. I want to know how much your scapula moves, or specifically how it moves, or if it can set back and down and get sucked into your shoulder blades and be able to move properly. So to check your scapular stability, pretty easy to do this guy as well. You're going to sit down against the wall, get your low back right against the wall, top of your butt, your whole spine is against the wall, you're putting your arms out, and you're seeing if you're able to come up into this position. Now, whole spine straight, we're seeing if those shoulder blades are clearing enough for us to come up, or if they're collapsed forward and they're not going to allow you to come up into this position. Really important to see how your shoulder blades are able to move to give you freedom of motion of your shoulders. Part 2, that's going to give us a good idea what your scaps are doing. Another self-test you can do to see how you move through your thoracic spine. Rotation and extension are what's called coupled movements through your thoracic spine. So your ability to extend your spine back and rotate it are very linked. You can check to see how well you extend it. If you weren't able to get your whole spine to line up against the wall here, you may suspect you have lack of extension in your T-spine. And checking rotation, really simple. You're going to sit down, take your hips out of it, sit on your feet. And if you can't get your knees into full flexion position, you can do it on the chair, but you should ask yourself, why can't I flex my knees fully? There's probably something wrong. Could be joint surface, could be a muscular imbalance, could be meniscus, could be a whole bunch of things, but that should get checked out. You should be able to do that. Next, you're going to put this guy across your chest and put your fingertips on your clavicles here. You're going to rotate as far as you can one direction, and then as far as you can the other direction. And you should be able to get past about 45 degrees. Now 45 degrees is just halfway to 90 degrees, so you want to be able to get to about there. If you're having trouble going one direction more than the other direction, that's probably going to tell you something that's going on. You're having a problem through there. Thoracic spine, check it out. Scapula, see how it moves and how it stabilizes your true shoulder joint. See if you're able to get your shoulder up, rotate it in both directions. Those are some quick looks at some of the most common areas where there's a shoulder problem. If any one of these are a problem, you're going to want to take a look at the next few videos that we're going to take a look at here to correct some of those issues.